about climate change and nutrition in Pakistan on the downstream effects and solution. This is rather very important topic that we have to deal with in all Islamic countries, especially all Islamic countries are more susceptible, are vulnerable to climate change. Dr. Bhutta is a distinguished university professor and founding director of the Center of Excellence in Women and Child Health and the Institute of Global Health and Development, the Aga Khan University, as well as the Inaugural Robert Harding Chair in Global Child Health and Co-Director of SickKids Centre for Global Child Health. He holds adjunct professorship at several schools of public health, including Johns Hopkins University, Harvard, and the London School of Hygiene and Tropical Medicine. Dr. Bhutta leads large research groups based in Toronto, Karachi, and Nairobi, focused on scaling up evidence-based community intervention and implementing reproductive, maternal, child, and adolescent health intervention in humanitarian settings. Dr. Bhutta is a fellow of Royal Society, the 2021 IHME Roux Prize recipient for significant research contributions to women and child health, and was awarded the John Dirks Canada Gairdner 2022 Global Health Award, one of the most prestigious global health awards. Dr. Zulfiqar Bhutta, please.
Thank you very much, Chair. And I'm very honored to be able to speak and share some thoughts with you on an issue which I don't think is just restricted to Pakistan. It is an issue of most low and middle income countries that are facing the global challenges of climate change. But I'm going to specifically focus my attention on some aspects that are relevant to maternal and child undernutrition. What I will cover in the next 30 to 40 minutes or so is a range of aspects of this topic, starting off with the role of climate change, health and potential pathways for nutrition impact. I'll talk about nutrition challenges globally, especially as they reflect on children and women and the status in Pakistan. Some recent data on climate change in Pakistan and projections, and our analysis, our original work on looking at the relationships between nutrition trends and granular information on climate change and stunting in children. And I'll then finish off with some additional information on what might be the implications for policy and action based on our recent exemplars work across various countries. So many people, not including this particular audience perhaps, do not know the difference between climate and climate change. And climate, as you know, is a reality. It's a highly complex system. It's the averaging of weather systems over a long period of time. Whereas climate change, as we understand, is much more recent changes in the aspects of climate, particularly related to warming in recent years. And this is particularly in the last century. As you can see from this graphic here, this picture of the glacier in Alaska, as to how much has changed within the last 50, 60 years. We are beginning to see these dramatic effects of global warming that are a consequence of the so-called greenhouse effect. This is one of the major contributors in terms of trapping heat in our atmosphere through an excessive accumulation of carbon dioxide. And this is largely a result of our own activities, human activities related to fossil fuels and other emissions that have led to depletion of the ozone layer in the environment and an accumulation of excess carbon dioxide that allows accumulation and reduction in heat escape into space, leading to a dome effect that I'll talk about shortly. Now, many of these effects are small. They're not huge, they're not massive, they're not seen within the next few years, but even small shifts in terms of overall global climate patterns have massive consequences. And as you can see, particularly when you have a small shift in the curve, you can have extreme weathers, and extreme weather can be both hot as well as excessive accumulation of ice and precipitation in some places. There is no question that over time, if you look at the last 150 years or so, the world is indeed getting warmer. And you can see in this graphic from Berkeley that the ocean temperatures and average mean land temperatures have climbed steadily over the last 50 years or so. And in particular, what has been noted are these extreme heat events. As you can see, the recent temperature changes, particularly over the last decade, have also led to some of records in terms of warmest years in recent memory. And that's largely a consequence of how some of these heat events can accumulate and lead to excessive heat patterns or shocks in certain geographies. Some of these heat domes are a consequence of just local conditions. High pressures in the atmosphere, which pushes warm air down, and in still and dry summer conditions, and at times, as is happening right now, with an early transition from winter to the summer, this gets extremely hot, leading to local aggregation of heat in certain hotspots. The world could get significantly warmer. And if it does, with what are the global targets of keeping it all below 1.5 degrees centigrade global warming, if it exceeds that, you can see clearly in these graphics here, in terms of events across the globe, and particularly heat shocks and heat events that could have a massive consequence for the entire planet. Now, why does it matter? What is the impact of rising temperatures? In very simplistic terms, the major impact is really on melting of our ice glaciers and our reservoirs, and increase in precipitation, excessive rain. As you can imagine, just now today, with the accompaniment to extreme heat events in South Asia, there is also excessive precipitation in some areas in the north that have led to flooding and will lead to flooding over time. So all of these consequences as a result of warming can have impact on rising sea levels, even disappearance of certain land masses, and certainly loss of land which is available for cultivation. The impact on the food and nutrition pathway is also complex. It is not just the fact that you can have reduced precipitation and therefore less water available and flooding and loss of cultivable land somewhere, but also increased environmental temperature can increase pathogen load that can affect agriculture productivity, and can also affect human patterns and disease. We are in the middle of a diarrhea outbreak in many countries of South Asia right now. And of course, food can get spoiled and food storage systems can get affected. What is also important are the direct effects of some of these heat patterns on human health, particularly on the health of women and children, pregnant women, that I will speak about briefly. But what has been noted in geographies where this has been calculated, that the impact of heat shocks and increasing temperature on agriculture outputs is quite significant, and is particularly for certain crops, particularly the kind of crops that we are dependent upon for a majority of our nutrient and micronutrient needs. You can see them here. Rice, wheat, sunflower, and also cash crops like cotton. These are data from California, Central Valley, but you can also see this across nutrient patterns in various other crops and products, that heat shocks lead to a reduction in protein concentration, especially if you are growing them under increased CO2 conditions. And this has been demonstrated particularly for C3 crops, but it is relatively less notable on maize and sorghum. There is also concern that in particularly C3 crops, elevated CO2 exposure can reduce micronutrient concentrations in crops, and particularly iron and zinc, which is so important for human nutrition. It has been shown that these, when grown under high CO2 conditions, have significant reductions in their micronutrient concentrations. You can see that very clearly in this graphic here, with a reduction in rice and wheat in terms of content of iron and zinc. But I talked about human health effects also, and there are complex effects of increased exposure to heat, climate change, on physical, mental, and community health. I will not go through all of this, except to say that we are very concerned about the impact on physical and medical health of women, particularly in vulnerable periods like pregnancy, lactation, and also the important relationship that's emerging on mental health and its consequences. We have particularly noticed this during COVID-19 as to how important mental health is to health and other outcomes. And as you can imagine, if all of this comes together, it can have a huge downstream effect on health. Well, the bottom line is, it's been estimated that climate change can have a huge impact on global food security. We have models that predict that close to 100,000 additional child deaths could occur, and 7.5 million additional children could become stunted over time with the impact of climate change. So what I'm talking about, ladies and gentlemen, today is not trivial. It is one of the biggest global challenges that we face. And this is a challenge that comes on top of existing global problems with undernutrition. I'm a pediatrician, and therefore I largely speak about women and children. But if you look at some of the global numbers around childhood wasting, children who are severely growth affected with low weight for height, across various geographies, this is a widely prevalent condition with over 45 million children under 5 wasted, with 19 million or so severely wasted. This is a reflection of acute malnutrition in general. But there is a manifestation of long-standing chronic malnutrition, which we see as children who are stunted. And this figure is close to around 149 million. And many of them are aggregated, concentrated in the geographies that we talk about, South Asia, where I work, and sub-Saharan Africa, that many of you may be aware of. Stunting matters for a variety of reasons. Stunted children have a significantly increased risk of dying. We believe that close to around 45% of all under 5 deaths are associated with some form of undernutrition. They have reduced ability to learn. There are documented impacts on cognitive development and long-term earning, long-term human capital. And at societal level, we estimate that stunting can cause countries close to around 10% of their GDP annually. So this is really quite a massive global challenge. And we have just published a whole series in the Lancet last week on looking at the impact of some of these deprivations on long-term human capital that I would encourage you to read. Last year, in our Lancet Nutrition series, we published these data, that there has been a gradual improvement in growth faltering in many countries of the world, but it is much lower in low-income countries than it is in high-income countries. And wasting rates, which you see on the right side of this graph, have remained largely unchanged over time. So it's not only a big problem locally, it's a big problem globally, and it has not been changing to our satisfaction. Now, the situation in Pakistan is very similar. And I've been tracking this for a long time because I work in this area. And in sequential nutrition surveys, what we have seen, if you concentrate on the period beyond 1995, over the last several decades, stunting rates and wasting rates in children have remained static, despite the fact that GDP per capita income has grown. The other thing that we note in Pakistan for stunting in children is that although I give you these national averages with 40% of the children being stunted, it is variable. There is differential across the north and south of the country, with the highest stunting rates being in the south of the country, here in the province of Sindh and provinces of Balochistan, South Punjab. And these regional stunting differentials can vary by 15 to 20 percentage points. Some of these stunting patterns are also quite egregious. And the worst form of stunting is that which is associated with wasting. You see the same pattern geographically, north to south on childhood wasting. Each one of these spots in this map is a district of Pakistan. This is from the National Nutrition Survey that I conducted in 2018 with the government, and it has district-specific estimates, as I will show you shortly. But the most severe form of malnutrition are those children who are both stunted and wasted. And when you look at that again, it is aggregated mostly towards the south of the country. So we have a problem, both in terms of its distribution as well as its severity, and also its consistency in terms of the interrelationships between childhood wasting, childhood stunting, and as I will show you shortly, with maternal nutrition as well. So there isn't time to go through the determinants of malnutrition and why has so little changed, but I just want to show you this graphic because I'll come to it at the end, that many of these things related to childhood undernutrition, particularly childhood stunting, are related to several tiers of determinants. Although we are all focused on those things which are immediate, like poor diets, food insecurity, disease, children with diarrhea, respiratory infections, and they in turn are related to things that are impacted by poor environment, living conditions, lack of services. But at the end of it all, it is the context, the underlying determinants, human, financial, physical, social, natural, and important things like climate change that affect a lot of these issues much more proximal. So we are very concerned that when we want to address stunting, we need a much more holistic approach that has to include actions at all levels. You will notice in this graphic that I've included something called intergenerational transfer. And what that means is that stunting today is also related to the health of the mother when she was a baby herself and maybe her mother in due turn. So there is an intergenerational transfer of growth failure and also the propensity to become growth retarded very early. There is, as I had mentioned, a close correlation with maternal and early child undernutrition. In Pakistan, we see that with the relationship between various factors like low birth weight, as you see in this graphic. The highest rates are in those women who are less than 18.5 BMI, wasted mothers. And you see the same pattern for stunting, wasting, underweight, all the way through. The worst outcomes are in women who are wasted and malnourished themselves. And you would then imagine that the distribution of maternal malnutrition probably ought to be comparable to what I just showed you for childhood stunting and wasting. And indeed, that's the case. This is a map for wasted women with a low BMI. And you will note that in certain districts of the south of the country, Balochistan and Sindh, close to around 30–40% of women are those with BMI less than 18.5. And you can clearly see a close correlation between this and the childhood stunting and wasting that I talked about. So these things are interrelated and something must be affecting it, both in terms of proximal and distal factors. Let's turn to the issue at hand, climate change and Pakistan. First of all, how strong is the evidence that climate change matters? And I'm extremely grateful to my colleague and friend, Dr. Peer Shaukat Ali, who works and leads a big program in the Ministry of Climate Change on climate change research. And he's shared with me data that I'm sharing with you. Pakistan has, by observations, and in comparison to many other countries in the region, including what is shown on this slide as Nepal, been consistently shown to have higher rates of change in temperature and reduced rates of precipitation overall over time. So this is not theoretical. This is data from between 1981 and 2016 that Peer Shaukat was able to compile. He was also able to document that if you look at the changes in temperature over time and region, there is not a single consistent pattern in the country. So these blocks, the various P's that you see here of the country, will show you that over this period of time, the increase in temperature was greater in the south of the country compared to the north of the country. And in quantum figures, less than what you see in Nepal. But Nepal has higher precipitation, so probably some of the effects were mitigated. So these are actual data. And on the basis of this, his group was able to model what might be happening over time and show a consistency with projections and global models such as the CMIP climate models for relevance to Pakistan. So clearly, even before and after downscaling, Pakistan has a significant problem with increased heat patterns in certain parts of the country. What parts of the country? So in projections that were made by his group, they've been able to show you a very clear gradient over time. And at two levels of projection, whether the change was high or modest, 4.5 or 8.5, you see over time that the projections indicate that some parts of the country may well become uninhabitable after 2041. And that Pakistan, unless things change, would reach the global upper limits of where we want the Paris Agreement targets of climate change of 1.5 or 2 degrees centigrade well before everybody else. So you can see this change happening very early. So there is absolutely a reason for us to be very conscious of the fact that extreme heat events in Pakistan, as shown here, will increase over time, and they will particularly be notable towards the south of the country. He was also able to look at what might be happening with monsoon patterns, and I find this very fascinating because what he has shown is what we are observing right now is that both patterns and timing of monsoons are changing in the north. And that will lead to increase in precipitation, increased rainfall in certain areas in the north, and absolute disappearance of rainfall from certain areas in the south. So in mostly our cultivable areas, if there is not enough rain, you can imagine what impact that may have over crops. So ladies and gentlemen, climate change in Pakistan is a reality, and it's a reality which is a frightening, fast reality. Those who are living in the country right now, I've just come from Pakistan, we are in the throes of one of the most severe heat waves that has been seen, and it is unseasonably early. It is April. People have not seen spring in Pakistan this year, and average temperatures in many cities have exceeded 40. So the big question is, does climate change figure amongst the drivers of childhood stunting and wasting in Pakistan? I looked for a lot of this information and I couldn't find it because it's not been studied. So we decided to study it ourselves based on actual metadata that we have from two national nutrition surveys that were conducted in 2011 and 18. And these are very large surveys, and both were done by my team. First one was provincially specific with 28,000 households and some 20,000 children. And the 2018 National Nutrition Survey had 100,000 households and almost 70,000 children, and an additional 25,000 women. So we abstracted all of this data from the survey on anthropometry, on many of the drivers. And for the 2011 survey, we obtained district-specific estimates using Bayesian methods. We had information on socioeconomic gradients, food security, maternal nutrition, education, WASH, for all the 140 districts of Pakistan for these 2 years. And that's why I've been able to create these district-specific maps using geospatial locations. We also have behavioral patterns of healthcare and other care seeking. And we assess differences in relation to many of these nutritional parameters and factors that drive them. For climate, we obtained matched data on mean surface air temperatures and soil moisture levels from the IRAS reanalysis dataset. We also geotagged these and used these to obtain district-specific maps, and then estimated through multivariate analysis their correlation with linear growth or weight for height over time to see if there were any associations. So a pretty complex process that has taken us almost a year and a half to complete, but that's what we saw. And the graphic that you see in this slide is people sheltering from the extreme heat events in South Asia right now. So let's look at what's happened to temperature over time. So I'm going to show you multiple graphs, and in the interest of time, just flip through them. So this is the average annual temperature for 2011 by geospatial patterns north to south. You can see clearly by 2018, there seems to be an increase. And when you look at and calculate this average annual temperature increase, there are some parts of the country, particularly, as I said, towards the southern part of Punjab, Balochistan, and Sindh, where this has been in excess of 1 degree centigrade, even just the last 10 years. So this is really quite alarming. When you look at precipitation levels, we get the same pattern that Pete Shaukat had modeled and predicted, that there are some parts of the country which have virtually no rain, and others in the north that have excess rain. And between 2011 and 18, this pattern became more obvious. And if you calculate, therefore, average precipitation change over this period annualized, you will see that there are parts of the country, and not just in the south, but sadly also including parts of North Punjab, where precipitation levels have really gone down significantly over the last 10 years. We did not just believe in the precipitation data, we wanted to calculate average surface volumetric soil temperature, the soil water content, which is a good measure of how much moisture there is in the soil. And when you look at this for 2011 by district and compare this with 2018, you don't have to be an Einstein to work it out that there is a problem. And many parts of the country now, particularly this belt, Balochistan and Sindh, is actually becoming very dry when it comes to soil temperature. Now, the area where I had the greatest difficulty of getting real data, and hopefully somebody in the audience or listening today might be able to get me some information which is reliable at district level of agriculture productivity, particularly crops that are in the food chain. We calculated agriculture yield in 2011 by various districts, and we tried to get this data for 2018 from various periods of time, and the data that we found was quite alarming. So I would need greater confidence in these figures because we have obtained these from sources which are relatively limited, but what they show is that there is a reduction in agriculture yield in some of the various belts, agriculture belts of the country, notably in Punjab, and I would like to have this confirmed. But the Lancet Countdown Commission for Climate has estimated changes in crop yield in Pakistan over the last 20 years, 25 years. And as you see over here, for many food products, particularly things like rice and maize, there is clearly an overall reduction. And we see this reflected also in our actual data from the nutrition surveys on food security. That there are many parts of the country where food security levels have gone up. So population by and large over time has become more food insecure. So what does all of this mean? So I'm just going to show you the multivariate prediction model, which includes everything controlled for things like age, gender, and regions, for what really drives linear growth amongst children in Pakistan. So this is a compilation of the significant drivers, all independently correlated, when put in a multivariate model with stunting in Pakistan. So it's not just one factor, it's multiple factors. So of course, poverty matters, maternal education matters, food insecurity matters, living in urban versus rural populations matter. Size at birth, maternal age, BMI, all of these things that we expected, they are all important drivers and they're linked. But the three things that jumped out for me was that there was a clear correlation in the last 10 years of the association of linear growth faltering with average change in temperature and average reduction in soil water. And you also see an association with increased diarrhea burden and growth faltering, which has generally been very difficult to document. So I think this is one of the clearest evidence that controlling for everything else, controlling for food security, food chain and all, climate change in Pakistan plays a significant role in affecting linear growth and maternal nutrition in children. When we look at wasting, the association is less robust, and there are some factors that we can't really explain very well, but we don't have generally good data anywhere in the world on the association of acute changes with climate change over time, because it's a much more progressive thing. So in the last section of my talk, I'm going to talk about more hopeful things. What can change? Despite all of this bad news, is there data from Pakistan to indicate that some regions of the country have actually been able to reduce stunting? And the answer is yes. And they're not the richest parts of the country only. We see a massive reduction in stunting in the north. My own province of origin, Khyber Pakhtunkhwa, as you can see very clearly in this graphic, over this period of time, 11 to 18, there has been a reduction in childhood stunting. And you see this graphically captured also in these two maps that you see for these two regions. And we calculated through a mixed method study that's in press right now, an Oaxaca blinder decomposition analysis, looking at drivers of this change in stunting. And the important finding from here is that it is related to a lot of multi-sectoral changes and approaches. So clearly poverty reduction matters, but also social safety net. So we have an income support program called Benazir Income Support Program, which is largely targeting women. And in our analysis, through these ecological factors, we found that it probably contributed to about a fifth of the change in stunting that we see in Northern Punjab and in Khyber Pakhtunkhwa. And there are obviously other things such as care, such as family planning, improved sanitation, and use of fortified foods that have also contributed to it. So very clearly, it can be done, and it has been done. And some of these interventions could be even more important during periods of extreme climate change. These findings are consistent with our global work on stunting reduction that my team has done across various geographies. And you can see some of those countries here that we have been looking at in Africa, in Central Asia, and also additional countries where work has just concluded, including Nigeria. And to cut a long story short, these are countries that have been able to reduce stunting over time pretty significantly at a rate of change which is around 3 to 5% annual reduction in stunting levels. And when you look at their drivers in this decomposition analysis, it's the same story that I just showed you for Pakistan, that a lot of direct sector health investments and nutrition investments are accompanied by major investments in indirect factors, fertility reduction, improvements in economy, parental education, investments in agriculture, and poverty reduction. So there is a story here that despite this doom and gloom of climate change, there are things that can be done by improving multi-sectoral investments and alleviating some of the effects that we see from extreme heat events and shocks. So let me conclude, ladies and gentlemen, by saying maternal and child undernutrition in Pakistan is multifactorial. And it's related to complex socioeconomic, cultural, behavioral determinants, as well as environmental risks and food systems. But these are risks to the major human capital of the country, and they need to be addressed now. And although malnutrition is concentrated, especially amongst the very poor, but it also cuts across socioeconomic strata. So it's not just a problem of the very poor. As you can see, in the south of the country, we also have relatively well-off people and middle-class people who are affected as such. I think I've shown you enough data to convince you that climate change is impacting food, water security in Pakistan in real time with additional exposure to disaster risks. And I believe that from our analysis, there are health and nutrition effects that are being observed in women and children as we speak in terms of growth retardation. What we will need for these actions is political will and multi-sectoral programs that will target reducing gaps, women's empowerment, and populations at risk. Heat shocks are a real crisis, and heat shocks have huge impact. We are encountering that right now, and I think they should receive a priority in terms of mitigation and effects. And I believe that academies, particularly academies of science across the Islamic world, including my own Pakistan Academy of Science, has a major role to play in terms of advocacy, bringing evidence information to the front to stimulate action. And that action is needed, ladies and gentlemen. This is the reality of many children living in rural Pakistan, families today living in dirty environment, without shoes, and also with unsafe water. This is an issue which is an issue of the country's future. If 40% of the population is stunted, this child from rural Sindh, I have permission to show this photograph, is 13 years old. Just look at how short he is. And this is going to impact his future and the country's future if we don't do something about it now. So together, let's make stunting history in Pakistan. Thank you very much for your attention.
Thank you very much, Dr. Bhutta, for this comprehensive presentation that eloquently connect food security with its different dimensions and manifestations with the climate change. It's really very, very interesting to connect that so that to ring a bell across the Islamic world, because this is a common problem that we face. Now I open the floor for questions or comments. Any Dr. Azhar, please. You are muted, Dr. Azhar.
It's all right now.
Yeah.
Good morning.
Good morning.
Just first, I have to thank Professor Bhutta for very, very enlightening talk. Thank you very much. The first question I am asking is about the water situation in Pakistan. Question is about the problem is we don't have enough water, or we have enough water, but we don't use it properly. I mean, we don't store enough water. What's the problem?
I agree with that, Professor Askar. I think the issue with water is both that of water security, safety, and also sensible utilization. So when we need to store water, we don't. So, and when we have excessive rainfall and crises, then most of that water is wasted. We have a tremendous amount of water loss in our irrigation processes because of our canal system, which is, a century old. And there are parts of the country where the problem is waterlogging and salinity. So it's a problem that requires a comprehensive solution based on science. I am convinced, based on the evidence that I've seen, that in addition to what community measures we will have around community approaches to water conservation and availability, that we require a move into drip irrigation and sensible irrigation strategies to optimize the water that we have. And that will mean that we have to take the water out of the feudal old system of water sharing to a much more sensible, science-based system of water utilization. Now, unfortunately, this is also a political problem, as you know. We have not been able to agree as a nation on a reservoir that could have really changed the nation's landscape over the last 40 years. We are now moving to storage, which is principally in the north. I'm very concerned that some of those are also affected by climate change and the vagaries of the instability of the rock system and structures there. But we have to do something about this as a nation. So I agree. I think water is a big issue. And as climate change impacts us more and more, this crisis will increase. Very few people know that a lot of the population migration patterns in Pakistan over the last 20 years, and also in Afghanistan, are related to just not having enough water. And if there is no water for irrigation, no water for agriculture, people move to other areas. And this needs to be documented, studied, and acted upon. Thank you.
Are you saying that we don't have enough water, or we have enough water, but we don't use it properly?
We have a combination. We have more than enough water where we don't need it, and at times when we don't need it, and we have no water in certain areas that no reservoir can change. Parts of Balochistan, parts of Sindh, which are outside of the traditional irrigation system, southern Punjab also included, will require other solutions than just depending upon water reservoirs, because we're not going to be building new canals. So we do need engineering solutions for this, which are a combination of both.
Yes. The next question is, because Pakistan is fundamentally an agricultural country, but what we know now, we are importing food. What's the reason for that?
Again, a combination, Professor. I mean, yes, we are an agriculture country, but we are not necessarily the best agriculture country in terms of per capita or per hectare production. Our agriculture systems are still archaic. The other thing is, we will never be food secure if we continue to have a population growth rate of 2.4%. If population growth, and that's why you saw, alongside what I showed you for KP and Northern Punjab, that the reduction in stunting was also accompanied by improvements in family planning and family size. So we have to control the rampant population growth in the country, which will by 2050 have doubled from its current numbers. We just don't have enough possibilities of feeding these people. And for how long can people go and find employment in the Middle East and feed us through the diaspora? So you have to create opportunities for our next generation. That does require that we limit the size of our families and population growth and provide people education in terms of doing this. So yeah, I mean, those things are interrelated.
But there's another problem, if you don't produce enough food, is it because the fertility of the earth is going down?
Yes, I think if you don't have modern agricultural methods, you will deplete your topsoil. Already there is evidence, Professor Saab, that in Pakistan, zinc in our topsoil is depleted. And that's one of the reasons why interventions have to include many of these micronutrient replacement strategies. So these things are interlinked also. And as I meant, if you have modern irrigation systems, modern agriculture systems, you will also improve your crop yield, production per hectare, just like we did with the Green Revolution. The Green Revolution that saved us from famine in the 60s, Norman Borlaug and Dr. Swaminathan, it wasn't just because of the variety of wheat that they had. It was also because that there were consistent improvements in irrigation and agriculture patterns at that time. So I think we need to have a holistic solution on this and make agriculture a science in Pakistan rather than just something that is dealt by politicians.
Yes, the water in Pakistan, the source of water are the rivers. We have rivers, and there's a treaty between Pakistan and India about the water treaty. How is it going to be affected by the climate change?
I don't have any colleagues from India on this particular webinar, but I would say the major risk is that the next big conflict in the region will not be on Kashmir. It will be on water.
Yes, we know that.
So as you can imagine, already there are moves in that direction by India, restricting the amount of water that flows into Pakistan. This is one of the vagaries of partition. We were left with our jugular in the hands of sometimes not friendly states. But I think there is no point in repenting over or lamenting over spilt milk. I mean, this is all water under the bridge. We cannot control those water sources by force. So it'll have to be negotiated through peaceful mechanisms. After all, the Indus Water Treaty was in existence and was reasonable for several decades, 40, 50 years. Even now, the issue is that outside of the water sources that come from India, there are also opportunities for Pakistan to do better. So let's get our house in order and at the same time use diplomacy and also promotion of peace as a mechanism for negotiating something which is far more important, in my opinion, than anything else. And no amount of nuclear technology or other capacities is going to impact the fact that you have to sit down on a table and negotiate.
Thank you very much for this one.
Any more questions or comments? Dr. Noor?
Yeah, may I have, I'm very grateful to Dr. Bhutta for a very extensive talk, on particularly in Pakistan. I was going to raise this question of population increase in Pakistan, which is eating everything. I think he's talking about 1960s when we were about 60 million, now we're 120 million. So I think it's very, very important. China has a model of development by controlling the population over 20, 30 years. And I think this is very important for Pakistan to control the population. 2.4%, extremely high. And this is important more than the climate change, I think, is one of the factors which the government of Pakistan has to put in very, very severe sort of regulations. And in Bangladesh has fortunately done it when it separated from Pakistan by controlling the population, and their economic conditions percentage-wise better than Pakistan. So this is one thing. The other thing, I think one of the important aspects which Dr. Bhutta has contributed to the stunting aspect of children. And again, this is again very much correlated to population increase and the poverty level because of the increased population of Pakistan, and they are correlated. One last comment I would like to make regarding the maps of Pakistan, which are taken from Google and do not show AJK, Azad Kashmir and Jammu as disputed territory. Some of the maps he has shown in the beginning were just taken from the Google, which is a prejudiced map and does not show. And I would request in future the maps which are shown. In the later part of the talk was a correct map which showed Azad Kashmir as a disputed territory and was not shown as part of India. So these are my few comments on very excellent.
Can I respond, Dr. Noor? I mean, I understand those comments, they are made many a times, but those are published maps from papers. So they're not from Google. They are from the actual papers themselves. And I can't go back and change those maps myself. So they are part of the publications. But yeah.
Papers of what? Papers of what?
Papers on climate change and other effects and those things that are available.
By Pakistani?
But our maps that we generate ourselves are like the ones that you have seen. So what I'm saying is, yeah.
But I think, it's even the published map, I have pointed it out to the international community and they do agree. But anyway, somehow it is our duty to point them out. They can be corrected, not mine.
Yes, but good morning. I think the map is a problem at the moment because India has published maps which have nothing to do with the reality. This is a geopolitical map, and they are forcing other countries to own that map. This is a problem.
But anyway, when we pick up, we can have our own correct map as per UN resolutions. That's nobody debars us from doing that. I have done that in international forum. So it's just a matter of.
No, I'm just pointing out where the problem is.
Yeah. Okay. That's what I pointed out. It's international problem, Google map, which is we normally take it. Okay. Thanks very much. That's what I wanted to make. Very excellent talk.
Any more questions or comments?
I would just like to know where Professor Bhutta is at the moment. Professor Bhutta, where are you at the moment?
Where am I at the moment?
Canada.
I'm in Toronto. I'm in Toronto, Canada. I divide my time between Canada and Pakistan.
All right. You are in Canada at the moment.
Yeah.
All the best.
Thank you.
Yeah, more